Well, welcome to the Valley Wellness Podcast, sponsored by Valley Hormone and Wellness Clinic. I am super excited today. This is one of my favorite topics. We are going to talk about exercise and how that can be beneficial to our health, and just talk about some of the things that are out there, things that hopefully will help people who are even in the beginning stages of learning to exercise versus someone maybe in more advanced stages. We obviously always encourage you to see a healthcare provider before starting any exercise program, just because everyone's at a different level of health. So kind of knowing what is safe for you is always a good idea before starting. But I will get us started here. Let's ask some questions. So let's just start right off with the question I get all the time. First of all, how important is exercise really? I feel like I walk around plenty. Doesn't that count? Does exercise really have any impact on my health?
I'm happy to start with that one.
Okay.
Have at it. Because I believe that exercise should be something that is prescribed to every person we see.
Yeah.
It is incredibly important. Walking around throughout the day is also important, but getting regular focused exercise where you're spending time dedicated to whether it's strength or your cardiovascular fitness is absolutely important. Would you agree?
Yeah. I mean, it's something I hear all day when I ask my patients about exercise, and they're like, listen, they look at me like, please, like, you have no idea what my day is like. I'm chasing 3 children under the age of 5 all day. I have a job where I'm on my feet all day. And I think, yeah, you know what? That's really good, because continuous movement throughout the day is really important. We know that even if you go to the gym for an hour every day and then you sit for 8 hours or more during the day, that's really bad for your health. So this continuous movement is really good, but it's usually not focused on building muscle. There are very few people that I can think of that actually have a daily routine that really focuses on balance and strength, even though they're, with their daily movement. So is it important to not be sitting all day? Is it important that you do have a life that keeps you really busy and active? That's really, really good. But it doesn't replace the focused building of muscle.
Yeah. I mean, I think movement is medicine. That's a phrase I've heard a few times, and I think that's absolutely true. It is great to walk around the house all day. Being up, any movement is great. And so I try to say, I don't discount anything someone's doing. So even if it's as little as going for a walk or two, that's great. That's better than not doing any walks. Unfortunately, if you're not willing to put effort and time into building up your muscle strength, building up your muscle mass, it's going to impact your quality of life as you age. I think it's especially important as we hit that kind of perimenopause to menopause phase that you actually start doing things a little more intentional, because it's going to make a difference on what kind of quality of life happens when you turn 60, 70, 80. Do you really want to be able to be with your grandkids? Do you want to travel? Do you want to be up and about where someone doesn't have to take care of you? So I really do feel like it's something that you have to have some intention about. And yes, it's great. Anything you're doing that's movement, fantastic. So don't discount that. That's okay. And you can do more.
Yeah, I agree. And I almost feel like we beat the muscle thing to death, but I don't want to apologize for it, because it is so important. Just because that muscle isn't just important for your strength, it's important for your bones, it's important for your brain health, it's important for your metabolism. And so be active, lead an active life, but also, the amount of time you have to spend really focusing on building muscle, even if it's something you hate, is pretty minimal. It doesn't require an extraordinary amount of time, but it is really, really important to focus time on that.
Yeah. And so let's say I'm a beginner. Mm-hmm. I've never lifted weights. You're talking about building muscle. What do I do to build muscle? Where do I start?
I think the most important thing there is make it simple. If you're intimidated by going to a gym, you don't have to go to a gym. You can start building muscle at home, doing things with just your body weight. You can do squats, you can do lunges, you can do push-ups. There are things that you can do to initially start that muscle building process. and become more familiar with the different types of exercises that you can do. The other really nice thing is that we live in this world where we have electronics at our fingertips, and there are millions of resources through Google or YouTube where you can get guidance as to what types of exercises if you need some assistance with ideas there. And then you build, and then you get some dumbbells if you're most comfortable at home, which some women are. Some women are fine to go to a gym, and if you're fine to go to a gym, there again are going to be personal trainers to kind of at least get you started so that you're not intimidated by the machines or the whole gym setup. And then as you become more comfortable, I think what's important is looking at where you're at in your phase of life, because I do feel that the exercise strategies to build muscle changes as we get older, and things that you used to be able to do as a 20-year-old that you could get by with and notice progress and gains is not the same as when you're in your 40s and 50s.
Yeah, no, I agree. And I think just to kind of go off what you said, we do live in an age where there's so many resources out there. I think just generally speaking, my recommendation, especially as you hit that perimenopausal to menopausal phase, is that you should try to aim for at least 3 strength training workouts a week. Like I like to see that if you can. And that doesn't mean a 5-hour strength training exercise.
It could be 20 minutes.
Yeah, it could be 20, 30 minutes. Hopefully 4 or 5 exercises will be a good starting point. You can look up bench press on YouTube, and there'll be 400 ways that shows you how to do the bench press. So it's not hard to get the information on how to do certain exercises. I get a lot of questions around this. Oh, well, I do 5-pound dumbbells. Is that good enough? No. Our hope is that you're trying to lift heavy.
Yeah.
And I tell patients to shoot for a set of 5 that you would fail around 8 reps. So you have a few in reserve. You're not risking injury as high. But 3 sets of 5 with a good 1.5 minute rest in between, where you're lifting as heavy as you could to do 8 reps, and you're doing it 5 times. Like that's a good mindset, I feel like, of how hard to go.
And really, I want to emphasize that too. You said 3 sets of 5. The amount of time that takes is so minimal. I mean, anybody can do that. And I know that some of my patients lead really busy lives. I mean, sun up to sundown, really, but these are things that you can incorporate when you're sitting on your desk, for every 30 minutes, every hour, get up and move, do 10 squats, do some curtsy squats. And some of my patients are like, no, I work in an office, and there's people looking, and I'm like, do you take bathroom breaks? 10 squats in the bathroom, do some squats in the bathroom, do some, we can find ways to really work these into our lives. And it's true. When you think of lifting these really heavy dumbbells, it seems so intimidating, but 5 reps, 5 times,
you can do that.
Just a few times, that's really doable.
Yeah.
I also think, when you talk to people and they say, I'm so busy, I go to work at 6 a.m. and then I commute, the fact that you're having the conversation means that it matters to them.
Mm-hmm.
And so sometimes it takes reminding them, this is important to you. That's why you've brought this up.
Mm-hmm.
Let's assess your day. Let's look, are there places? Because even if you have a really busy life, carving out 20 minutes, which really would be enough to get a good muscle strengthening workout in each day. Can you find 20 minutes? Most of us can.
Mm-hmm.
Most of us are going to spend 20 minutes when we get home and sit down to decompress.
Scroll social media.
Yes. So I think a lot of the time helping someone realize that if they just prioritize and adjust things a little bit, they'll find the time.
Yeah, and there's just this common idea, I think, that in order to really be strong and to really work out and that you're going to need to take this hour and a half every day. You're going to have to drive somewhere to do it. You're going to have to find, and it is I mean, I don't know many people that have that much time.
Right.
We would all be really, really
Right.
unhealthy.
It doesn't have to be like that.
Mhm.
It can be. Some people prefer that because they like the social side of that, but it doesn't have to be that. If you've got limited time and you've got a goal, you can work it in.
Yeah, and I think as we go, we do have a couple questions about what if my time's super limited? Are there some tricks to trying to get some exercise in? I want to talk about that as we go. I do think that weight training is not the only exercise that I recommend to patients. So I like the 3 strength training workouts a week. And then I also like to encourage doing some sort of cardiovascular building, whether it's walking. Some people like ellipticals, some people like bikes, some people like to run. And I feel like that one is pretty flexible to what people enjoy. And sometimes like, well, what's the right one to do? And I think, well, what's the one you like the best? I think the answer can be very individualized to somebody. I don't know. What's your recommendation as far as cardiovascular health?
I like to encourage people to go to the rec center and take a bunch of classes and see what they like. Try
get some variety.
Zumba, try a cycling class, or if you don't like going to the public places, then get a weighted vest and go for a walk. With that additional weight, it helps you get your heart rate a little bit up a little bit more. If you like hiking outside, that's fantastic. Find something that you love, that you enjoy. If you like doing it on your own and that gives you some personal time, some meditative time, then do that. If it really helps you to have a group, to make it a social activity, get a few friends and hold each other accountable. Find something that you enjoy. Movement can be very emotionally therapeutic. And you can get it in that way, in a way that's enjoyable.
For sure. Yeah. And for sure, movement is not just about building muscle. Like it is really helpful for stress relief. It's definitely helps with depression symptoms. It can be helpful for sexual function. Like there are so many benefits that we're finding with movement that it's like, there's not many things that you can personally decide to do that have this much positive impact on your health.
The thing I love is with cognitive decline. The fact that exercise can help us stay more functional with our minds is very important to me. That is one thing that is enough to keep me in the gym, to keep me doing strength or cardiovascular exercise.
Yeah, there's actually been some interesting studies come out about Alzheimer's and exercise, especially if you're willing to do a few pulses of extreme intensity, like even a couple of times a week, like for a couple of minutes.
I've started doing that. I used to be the long distance runner where I ran 7 miles every day. That was what I did for exercise.
She also ran with a broken foot, just so you know. She's hardcore.
A little bit crazy. But I've switched it up and started doing the sprint training because of the benefit for cognition and for metabolic function. And it's so much easier. It takes so much less time. Yeah. You do 30-minute sprints of whatever, something at the highest
30 seconds. 30 seconds.
At the highest intensity, 30 minutes, we would not last that. This whole sprint training takes less than 30 minutes, which is amazing.
Yeah, 5 to 10 at most.
Yes. 5. Yeah. 5 max.
Yeah.
If you do 30 seconds at the highest intensity and then you rest for a minute and a half to 2 minutes.
Mm-hmm. And then do it again
so much
up
easier.
to 5 times.
And I will finish this little stint of training with jelly legs, which I didn't have at the end of my runs a lot of the time.
Yeah, when you think about the way that the brain is vascularized, the vast majority of that is microvasculature. These are veins and vessels that are, smaller than the size of your hair. So when you get that heart rate up, the amount of oxygenation that gives to your brain is so beneficial. And then it improves your VO2 max, which is one of the better indicators of longevity. It is a minimal amount of time that has a dramatic impact. That is the most bang for your buck.
So if you want to have a functioning brain and be able to function physically, exercise. Yeah, I think everyone is into that. Well, let's ask the next question. So I get this a lot. Like, I'm worried about exercising. What are the dangers of exercise? What do you find is a risk that you worry about?
I don't feel like there's really any danger to exercise assuming that you're doing it correctly and you don't have a health condition that would maybe put you at risk. So you did mention initially that you should speak with a healthcare provider before you start an exercise program.
For sure.
But assuming that you don't have a heart condition or something that puts you prone to injury, exercises, all positives.
Yeah, I think injury really is the only major downfall, which really happens when you push it, doing exercises, even though they cause pain. When you over-exercise, you go from a completely sedentary life to deciding you need to go to the gym and lift weights for an hour every day, then you're putting unnecessary stress too quickly on your body. So really, doing things, slowly increasing your level of activity, without causing pain, without causing distress.
There's going to be a little bit of pain.
A little bit. But,
it's good pain.
A side ache is not what we're talking about.
It hurts so good.
Yes.
You really have to push it pretty hard. We're talking about like almost pathological conditions where people are stressing their bodies by over-exercising.
Sure. Yeah, and I think that's a big part of it is making sure you have adequate rest intervals in between your exercise routines, making sure you're getting some stretching, flexibility improvements before you do exercising. Hydration is important. I think none of us would recommend that a patient with no training goes and runs a marathon tomorrow. So I think common sense things are the things that keep you from having any major injuries or health risks from exercise. So starting slow, having routine, having adequate rest, keeping yourself hydrated, keeping your body fueled. Those are things that keep you from having problems from exercising. And that feels like it's mostly common sense.
The reality is if you listen to your body, you're going to know.
Right.
So pay attention to how you feel. If you're feeling a little winded or got a little bit of a burn, you're great. But you've got to pay attention to how you feel. And if you can keep it at that level, you're likely not going to hurt yourself.
Yeah. I get questions about lifting weights and injury because I know you'll see a video, someone's doing the bench press and they'll tear their pectoral muscle or something. And I think if you keep that guideline of having some reps in reserve so that you can maintain your form, if you do a little bit of research and find out how to do exercises correctly, it isn't going to take that much to prevent yourself from getting hurt. And it's nice to have a training partner. So if you're not sure where you're at, having someone that can spot you and make sure that what you're lifting is appropriate for you so they can help out is a great way to protect yourself from getting injured. And even if you're by yourself at the gym, you can ask. Most people are happy to spot you or help you at a gym. So
if the movement seems a little complex, you can choose a different one.
Yeah, yes.
True. I'm not going to be doing any cleans or anything like that because I don't know how.
And you can learn how to do them. So there are options out there. Here's one I think is important. I feel like it can be frustrating. We talked about the fact that there is a lot of information out there. There's a lot of exercise influencers. And sometimes it feels like you see one person say, oh, you need to be doing this. And the next person comes on and says, oh, no, they're doing it wrong. You need to be doing it like this. And it almost feels like no matter which way you're exercising, somebody's telling you you're doing it wrong or that this isn't going to help you.
The reality is a lot of the influencers have zero training or degree that gives them the ability to tell you what you should be doing. They're influencers, they're popular for different reasons, and then they choose to give this sort of advice. And so the important thing when you're trying to know who do I listen to is finding reputable sources. Find someone who has education in exercise science, who actually might know the science behind the recommendations that they're giving.
Yeah. I mean, part of how you get lots of followers and views is to be really opinionated about things. And it's the same like with diet. Everybody's got the specific, you're supposed to be paleo. You need to be, a keto. You need to eat this, and the reality is not everybody's body is the same. And, not every diet is going to work for them. And you're just going to have to figure it out on your own, what works for you. So just because I have a few people that I follow just to get ideas for my exercise, and sometimes they'll say something or they'll recommend a certain exercise, and I look at it and think, oh yeah, no,
Not for me.
That is not for me. Going to go ahead and weed that one out. And it's important to look at everything in life that way.
Yeah, I mean, if you look at our scientific approach, it's all generalizations, right? Even when we do a study, let's say we bring 1,000 people in and we study a certain exercise or exercise strategy, and this one seems more effective than another, it's an average. It's not an individualized necessarily. So everyone is a little different on how their body's going to respond to exercise and what they do. So it isn't always going to be, well, science says if you do this, this works perfectly for you, and everyone.
My textbook says you should respond this way.
Right.
Well, which is why, I mean, there is information out there that will say this works better for women, and this works better for women in this phase of their life. And then you go to the gym and you see a woman who looks very fit and she's not doing what it says she's supposed to be doing. That's because we are all unique.
Right.
And it clearly is enough for her body. But if you have a woman who's stuck, she's like, I've been running an hour every day. I've been doing 20 minutes of strength 3 times a week. Why am I not changing? Why am I stuck? Why is my body not doing what I want it to do? And that's where you have to sit down and look at what the research really does show. Talk to her about other factors. Are you training fasted? Are you fueling your body the way that you need to fuel your body? Like there's something that we likely can find that can help them, but doing it maybe not the absolute best way will work for some women, but not for all.
Yeah, you brought up an interesting point. There's actually been some new evidence around training fasted for women in menopause age. Do you want to talk about that?
Well, this is something as I was preparing for this podcast that I realized I train fasted every day. And it's kind of frustrating to realize I'm one of those people that have a very busy life. And so I train during my lunch break, and I usually haven't eaten since breakfast. And so it's been 3 hours since I've eaten, which technically is training fasted.
Yes.
So I will admit that is a new change that I am making because yes, the research is showing that men are fine to train fasted, but women are not. Women actually train better, are more able to meet their goals in terms of their intensity when they're not fasted. It also helps keep our level of stress and cortisol in a healthy range.
Yeah, so it's interesting that women's cortisol level really jumps up when they're in a fasted state. And unfortunately, that's one of those hormones in your body that can sometimes not help with your muscle mass and maintaining muscle mass and building muscle mass.
Or weight loss or mental health or sleep.
Cortisol
patterns.
is not our friend always. So it's important to realize that it's not a crazy amount. I think studies have been showing just 15 grams of protein before your workout is all it takes.
Or half a banana.
Yeah. So it doesn't take a ton of protein in order to unlock the best possible muscle building for you. Now, like we've talked about, everyone's different. Some people are like, I do fasted and it works for me, and that's okay. It's just that some research is showing if you're struggling and you're plateauing and you feel like you're kind of bonking out during your workouts, that having like a half a protein shake before you go work out can be beneficial in your workouts.
I think it also brings up an interesting point when we talk about the research that gets presented and the information that influencers and online resources are giving. One of the things that I think we're coming to realize as there's more specific research done on women and on perimenopausal women is that what all the evidence before now has been done on is men. And we treat women like little men. Like we're just smaller men. But we have different body compositions. We have different hormone balances. We have different responses to all these different stressors. And we are not just little men.
No, our muscle fibers are different. Our brains work differently.
We actually produce different types of muscle fibers that are going to respond differently to different kinds of stress. And as we do more research on this specific group of individuals that has has been severely neglected over time, a lot more of information is going to come out on this. So it's important to really recognize what works for you, recognize that maybe the information you're being presented with is not for you, that you are a little more unique than the research that has been done.
Yeah.
And yes, this idea that women should eating less all the time is very archaic.
Oh, yes. I think that's probably one of the biggest disasters we've had is this idea of calorie restriction. And unfortunately, sometimes that works against muscle building. So
be skinny. And really what we end up is with our metabolically unhealthy, thin women.
Yeah. And one of the reasons we like to encourage women to be seen is to get a body scan. I think one of the things that's nice to find out is what is your muscle mass percentage? And we have people who exercise religiously and may show up and find that their muscle mass is in a place that's very dangerous for osteoporosis in the future.
And their visceral fat is quite high. It's this paradox of thin but metabolically unhealthy people.
Yeah. And so it's worth coming and getting that checked out, I think. And that helps maybe tailor your trajectory going forward and the time you spend exercising, what things will be most beneficial for your future. It was interesting that you brought up how different men and women are. One of the benefits that women have, they found more recently when they're actually studying just women, is their recovery time can be a little bit faster than men, which was interesting.
I loved learning that, actually.
and we actually can spend less time actually working on our muscle mass and then recover more, and we get more benefits that way.
Right. The greater the benefit. And it makes sense because if you are giving yourself too much time to rest, your body can start to kind of go into that recovery mode where there's too much time between the stimulus. And so for women, what we're learning is that we only need 1.5 minutes to recover, and we can go back and do that same exercise again and have better improved benefit, and yes, get our workouts done in a shorter amount of time.
Yeah, and if you looked at the traditional recommendations, especially with weight training, they were telling you, 3 to 5 minute rest in between lifts. And
that
like you were
takes
talking about, that is a very male dominated research finding, was that was beneficial. For women, they don't need it. So that is one way to really save yourself
very
some time.
Responsive muscle
I know,
fibers.
they're so responsive. Here's a question I get off a lot, and I think this is something we all can struggle with at times. I start a program, and I'm going really good for a week or two. I lose motivation, and I just kind of stop and go back to doing nothing. What can I do to stay motivated? What can I do to keep going?
I think it's significantly easier for some people. For me, I tend to stay motivated easily because I've been able to recognize how I feel when I exercise. And I know that the days that I don't exercise, I don't feel as alert. I don't feel, I feel more stressed. My energy is affected. And so I've been able to recognize those benefits that I get from doing it. But sometimes you get bored. Sometimes it's like, I don't want to go and do that same thing that I've been doing for the past 3 months. And you have to get creative and realize that that's okay. So if you don't want to go, for that run, go for a hike. Do something with a friend.
Yeah. Anything you do to move. I think the most common scenario I run into when somebody says this to me is that they've tried to do too much too quickly. Too quickly.
Yeah.
It's like the New Year's resolution phenomena,
Yeah.
right?
About 2 weeks of really hardcore.
I got a gym pass. I'm going to do this. I'm going to be there every day. And I think, relax, right? That is, you are going to burn out so fast.
Right.
Set really realistic goals in small increments. Just because you've decided that you're going to go for a 20-minute walk 3 times a week after dinner doesn't mean that you're never going to increase from there. It just means you've set a goal. You've been here and maybe in this place that's pretty sedentary. Maybe you're a little more active and you're just going for smaller increments. And when you're doing smaller increments above what you've been doing and incorporating that slowly into your life, you allow that to become a habit without it becoming overwhelming. And if you're somebody that gets bored really easily, then tell yourself you're going to stick with this activity for 2 weeks and then have a list of different things you want to try that are going to keep you curious and, satisfy this variety in your life, and give yourself 2 weeks with one and have a list of other things that you're going to move to after that. I really like going for walks, but you know what? Walks get really old after a while. And sometimes I don't have a podcast or a book that I want to listen to that's going to occupy my mind. So I need something else. I recently discovered Bagua, a Chinese martial art. It is fascinating to me. I never thought that I'd, be doing something like this. And right now that has captivated my attention. But I have a list because I know that it's going to get old. I might have some attention deficit issues.
It might take a while for Bagua to become boring to me. It sounds really
especially when the swords are involved.
Yes.
Then it gets really exciting.
And it's something that I do with all Mandarin-speaking people.
Yeah, I'm kind of like you. I get bored really easy with one particular type of exercise. So I am constantly rolling through running, walking. I've done Krav Maga classes. I've done
Krav's fun.
So I think variety for me is very helpful. And everyone's a little different. Some people just like consistency. They want to do the same thing, and that's okay.
That's me.
It's great.
That's great.
I feel so boring sitting next to
That's
you.
okay. That's okay. I like trying new things over and over again. So for me, just learning about something new. I'm always the beginner, so that's the only negative. But
you know what, though? That's
okay.
good for your brain health. That's good for neuroplasticity.
There we go. Exactly. So it's a benefit on that side.
I know somebody who's really into the martial arts, been doing it for a long time, and he always says it's really important to occasionally put on a white belt.
That's true.
It's good for your brain.
Yeah. Keeps you humble.
Yeah.
You're the newest one at every time. I think one of the other really helpful things is accountability, and whether you actually write down the goals somewhere where you can actually check off doing them, or whether you have an accountability partner, so a friend, a spouse, loved one, stranger online, whatever. That has been one of the ways that people have found success with sticking to programs, is having somebody to do it with. And having someone to go to the gym with is a great way to do it, because when you wake up and you're like, I'm kind of tired or have a little bit of headache, I don't really want to go today, and then your friend texts you and says, hey, I'm coming by, let's go. I think it just gives you just that little extra boost to say, okay, I could do this.
Yeah. For me, I've got my smartwatch, and I'm friends with my brother and his wife and my other sister-in-law and my sister. And so when I get that notification, oh, Nathan just finished a workout. I'm like, oh, I got to make sure I get my workout in. I can't have him beating me. So you don't even have to have these people are living in a different state.
Right.
So they're not here with me, but they're with me, reminding me.
Yeah. I have my Aura
workout
ring
done.
But, when I start to slack off, I get a little notification. Pay attention. You're not reaching your activity goals.
Please get up and move.
I'm going to throw that ring at the wall.
It doesn't break when you do that.
Oh, dang.
So it's fine. It's therapeutic.
Well, let's talk about age and exercise. So at what point is it too late to start exercising?
Never. It is never too late. You might have to start out a little bit differently, a little bit slower, but they've done research on elderly people, 70s, 80s. 80s is pushing it. But starting to increase your activity even at that age will bring improvement in your physical function as well as your cognitive function.
Yeah, the studies on that are actually really cool, specifically the cognitive benefits for elderly populations. I think they go up into the 90s.
Do they?
Yeah. There's pretty much no age where exercise isn't beneficial for your health.
I'm going to be honest with you. That's kind of how I keep myself motivated. I signed off social media, but occasionally I have to sign back on. But the people that I follow are mostly over the age of 60. They're in their 60s, 70s, and 80s, and they're really active. And watching what these people are capable of doing keeps me thinking, oh, yeah, you know what?
That's what I want.
That's what I'm going to be.
Yeah, I think the answer we all agree is there's really no age that we would say you don't have to exercise. I think it's beneficial. And even if you've never done an exercise in your entire life, you're 85 years old, start then.
Start small.
Yeah, start now.
But you can do it.
Yeah, and it will actually improve your quality of life in several ways. So it's worth it. Okay, how about stretching? Stretching, I heard, is important. What kinds of stretching is recommended?
Yeah. So, I mean, before and after, or even just daily throughout the day, range of motion is really important to maintain for anybody of all ages, but especially as we start to age and we start to develop issues with arthritis. So there's different types of stretching, static stretching and dynamic stretching. Really, before you start a workout, it doesn't have to take very long, but getting your heart rate up really quick, doing some high knees, some jumping jacks, and then dynamic stretching where you're utilizing your full range of motion, leg swings, arm swings. And then after exercise, a more static form of stretching where you're pushing it just to a slight level of discomfort and holding it for, 30 seconds can help with muscle recovery, can help prevent injury.
Yeah, I get a lot of questions, especially in my pregnant population, about back pain. And they're like, what can I do? What stretches are out there? Any ideas for someone who's pregnant that needs to stretch?
I usually, again, will have them turn to their electronic device and find a prenatal yoga, because there are a lot of different yoga sessions that have been published on YouTube. And my husband and I have one that's like 20 minutes that we'll do like 3 nights a week together, a little bit of bonding time and stretching time. I don't have back pain, but he does. And so it can be really helpful to minimize those types of discomforts. But I feel like either a short yoga session for a pregnant woman that's tailored to a pregnant woman is probably a safe way to go to minimize injury for them.
Yeah, you can't bend over and touch your toes at some point, but you can, prop one leg up on a chair and reach for your toe that way. There's lots of different ways to modify, body twists, arm stretches, pulling one elbow behind your head, clasping your hands behind your back and stretching your arms.
Remembering that your center of gravity is different, so your balance might be a little shifted.
Maybe fewer one leg balance things.
Yeah, and this is one where there's so many resources online for stretching. There's lots of stretching routines you can go through. Yoga, I think, is a great one. I'm 6'5", and I'm probably the least flexible person in the world, and I do yoga. And
we'll have a least flexible competition after this because
I'm not pretty, and still I really have way better range of motion and movement after doing some stretches. So it is something that I would encourage you to incorporate at least a couple times a week. If you do it every day, that's great. It doesn't take very long. It only takes a few minutes. If you're just doing a little bit, you can also do a full 30, 40-minute stretching workout if that's what you want to do for your workout that day. But it really, really can be beneficial to your range of motion, which is something we all want to have, right?
Need.
That's how you can still do things with your family and be able to function. How about balance? Balance, I hear, is important. Are there little things you can do to help improve your balance?
Got to practice. It's like anything else. You want your balance to improve, you have to work on your balance. I've got, one day a week where I incorporate a little bit of balance training. Again, mainly because I want to keep my balance as I progress through age. And if you ignore it, eventually you find yourself where you don't have good balance.
Right.
And it is harder to get back once you've lost that. So start where you're at, but it is something that you put time and effort into on a daily basis, whether that is if you are able to stand on one leg and do some balance training. It not only, again, is going to help with your balance, but it's going to help with your cognitive function.
Yeah, I have a few methods that I incorporate for this. I've mentioned before on this podcast that I've got, a degenerative joint condition, rheumatoid arthritis, and ankylosing spondylitis. So range of motion and balance is really important to my training. And I don't know that what I do is something I would advise for everybody, but we do know that it improves your balance when you train barefoot rather than in shoes. So,
Right.
I only train at home. So I do all of my training barefoot. And I use free weights rather than machines because that also forces you to utilize your balance. I also like kettlebells, one-armed swinging motions, partly because I have to use my full range of motion, but also because that incorporates a lot of balance into my training. And then again, I mentioned I have started doing this martial art that really requires an extraordinary amount of balance. It's almost, one of the biggest components of being able to perform these forms is being able to maintain balance. So it is really important, and it becomes a lot more important as we age and we become at greater risk for falls, making sure we have the balance to prevent falls, making sure we have the muscles to catch ourselves when we do fall, and then, the strong enough bones to prevent breaks when we do fall.
Yeah, I remember you told me about one that you talk to patients about is when you're brushing your teeth, stand on one leg.
Yeah.
and then alternate back and forth. Like such a simple way to practice balance.
I did tell you that.
Yeah. That was a great one.
Yeah, I also talk about that for neuroplasticity.
Yeah. So both are great. But yeah, that unfortunately balance is something that affects as we age. Having a fall and breaking a hip is one of the scariest things for someone as they age. So practicing things to maintain your balance can be really beneficial in preventing that as you age.
Falling and breaking major bones is usually the last major life event for people.
Yeah. What resources do you guys recommend? I mean, there's a lot of stuff out there. Do you have any books you like? Any specific web pages you recommend people go to? I've got a couple. I can say mine, but
say yours. By all means.
I like Fitness Over 40. That's by Dr. Vonda Wright. She's really good. There's a lot of good podcasts out there. I really like Dr. Stacy Sims. I think she's got a lot of very current information, especially about women's exercise and health. She's done some podcasts and she's got a web page, so she's a good one. I actually really like Jeff Cavalier. He does Athlete X. He's really good on technique. He has a million YouTube things that you can get for free where you can just go right to and learn how to do the bench press or learn how to do a squat correctly or a deadlift or even a power clean. So I think he does a really good job being very precise about movements. And he's really good. He has lots of exercise programs and stuff that you can do that you can pay for, but there are a ton of stuff that you can get for free.
I mean, I have a few people that I follow for workout ideas.
Great.
So I guess we can mention those. Just on social media, I like ShaynaMarie.b and I like Built by Becky just because they're very strong women.
Mm-hmm.
They're very simple exercises that don't require a lot of equipment. And I like choosing women that look really strong. Keeps me motivated.
Yeah.
I mean, just most of those podcasts that you mentioned, I also really like Peter Attia as far as, workout. He gets maybe a little into the weeds, pretty detailed. But if you want to geek out, that's a good way to do it.
Yeah. I mean, the reality is it doesn't have to be complex. Like this can be something that's easy, something you enjoy. I think you will find as you exercise, you do end up liking it. And like you talked about earlier, as you kind of get used to what you feel like when you're exercising, when you don't, you realize, hey, I didn't exercise and I can feel it. Like you start to realize the benefits are pretty clear in how you move and how you feel and your energy level. Your mental health is affected by it. So overall, it becomes pretty easy to see that exercise is something that's beneficial.
Add to your life.
Yeah.
I'm not going to lie. It's really hard for me to get started every time. I think I'm really going to do this. And once I get going. But
don't you notice, if you just make yourself start.
Everything is fine.
Yeah.
I love this. And then trying to get my protein before, get that scoop of protein powder in my coffee. That actually has made a big difference in the amount that I'm able to exercise and my energy levels throughout the day. It's made a huge difference. So it's okay if it's really hard to get started.
Yeah.
Just make yourself just say, okay, I'm going to give it 5 minutes.
Mm-hmm.
And what you find is once you get in there, you're like, oh,
I got this.
Okay.
Yes, I got it.
Okay. Well, before we end, I want you to guys give me some tips for people who really, really are limited on time, like things you can do to improve movement when you really just feel like I have no time today. Is there anything that you can help with?
I think Jen's already mentioned some really good things. Do some body squats, some lunges in the bathroom if you have to at work, by your desk if you have a space that you feel comfortable. Just move as when you can. Find that time.
Park farther away.
Yeah, park far.
Take
That's
the
a good
stairs,
one.
not the elevator.
Yep.
Well, and Jen's got her weighted vest that I could barely lift off her floor.
Yeah, you can just wear that around the house.
Wear a weighted vest as you're walking around the office.
While you're folding laundry.
Yes.
put that weighted vest on
while you're at home.
And, this idea that your workouts need to take a lot of time. I think we've emphasized really well that, especially for women, the research shows that it doesn't have to take an extraordinary amount of time. You can get a high intensity interval training, a HIIT workout in like 5 to 10 minutes.
Okay.
If you can carve out 5 to 10 minutes, get on YouTube, search 10 minutes, 7 minutes, HIIT workout, no equipment, get it done.
But don't waste that time.
Mhm.
Realize that a HIIT workout is a HIIT workout. It is intense. Give everything you've got for those 10 minutes and you'll get benefit.
Yeah. Well, thank you. Hopefully this was helpful information. We appreciate you listening in and look forward to talking to you again. This is, again, the Valley Wellness Podcast, sponsored by the Valley Hormone and Wellness